Let's talk about the recent news around changes to the administration of J&J vaccine. This morning, we learned that the US CDC and the US FDA recommended a pause on the administration of J&J vaccine out of an abundance of caution. This pause came after the detection of 6 cases of a rare, severe blood clot called a cerebral venous sinus thrombosis, or a CVST. That type of rare blood clot was seen in combination where individuals also had low levels of platelets after they had received the J&J vaccine. It was this combination of events that caused the US CDC and the US FDA to recommend this pause. All 6 of these cases occurred among women between the ages of 18 to 48 and occurred between 6 and 13 days after they received their dose of J&J vaccine. Of those 6 cases, they are currently evaluating them right now, and I'll talk about that in a moment. But none of those 6 cases occurred in Maine. Now, the reason why this is of note is that the treatment for this type of severe blood clot is different from the treatment of other blood clots. Typically, physicians treat a blood clot using, for example, a type of drug called an anticoagulant, something that out the blood. You may have even heard of some of these. One of them is a drug called heparin. But with this type of blood clot, with these CVSTs, that standard treatment using a drug like heparin might actually be dangerous. And patients who might have this type of blood clot may need another type of treatment. Now, tomorrow, an expert advisory committee for the US CDC is meeting to review and analyze the data around these 6 cases. Until that review is complete, the US FDA and the US CDC are recommending a pause. Now, why have federal officials recommended this step? Well, right now, the purpose is to ensure that the healthcare community is aware of this possibility and that they are ready to recognize and treat any instances of this type of clot. We here at the Maine CDC have already notified 2 different groups of people. Early this morning, we notified vaccination sites that were administering the J&J vaccine that they should pause. And just in the last hour, Maine CDC has sent out an email notice, or what's called a health alert, to healthcare providers of all different stripes across the state of Maine to let them know what we know about the situation right now. In addition, Commissioner Lambrou and Governor Mills and I have spoken with our partners at the federal level to make sure we too are keeping on top of the situation and have the latest, most up-to-date information. But I know that this news raises concerns and it raises questions. For many, this is a bump in the road. For example, I've already received a number of questions from folks who have recently got the J&J vaccine, and they want to know what they should do. Let's first acknowledge that for those of you who recently got the J&J vaccine, this isn't what you were planning. But here's what you should do. If you got the J&J vaccine in the last couple of days, it's normal that you will feel some flu-like symptoms. You might have some pain in your arms. You might have a little bit of fatigue. You might have some body aches. What we're talking about today is not that. What we're talking about today is something that happens anywhere from 6 days to 2 weeks after that shot. And so if you are within that window of 6 days to 2 weeks, and you have symptoms such as a severe headache, severe being the operative term. Some people describe it as one of the worst headaches of your life. If you have a severe headache, or things like abdominal pain, shortness of breath, or leg pain, contact your healthcare provider. Now, it's also important to keep in mind, if you just got the J&J vaccine, that what we are talking about today is extremely rare. Again, 6 cases that have been detected across the country out of 6.8 million doses of J&J vaccine that have been administered. That's fewer than 1 in every million. The other thing that's really important to note is that we are not seeing these types of events with the other 2 vaccines that are currently authorized in the United States, that with Pfizer and that with Moderna. We have not seen any reports of these types of blood clots with those vaccines. And that's why I continue to urge folks to sign up for slots with those vaccines. Even though the administration of J&J may be on pause right now, our administration of Pfizer and Moderna vaccine is continuing unabated. And that's why I continue to urge folks to keep signing up for vaccines for Pfizer or Moderna shots as quickly as you can. Again, we are still seeing cases, and that's why getting vaccinated remains one of the best things that you can do right now.